So today we will discuss about dehydration. As soon as the shoe has been fixed and the bones and teeth have been decalcified, it is necessary to remove the fixative and water from the tissue and replace them with dehydrating fluid in preparation for impregnation. So this process of removing intercellular and extracellular water from the tissue following fixation and prior to wax impregnation is known as dehydration. And the solutions utilized to make this possible are called the dehydrating agents. Okay, so after fixation and then after decalcification for the hard tissues, so dehydration will now start by placing the fixed specimen in 70% ethyl alcohol in water, progressing through 95% ethyl alcohol up to 100% ethyl alcohol. For delicate tissues, particularly embryonic tissues, dehydration starting with 30% ethanol is recommended. It is also important to keep the dehydration times as brief as possible to minimize the risk of extracting cellular constituents. So as a general rule, whatever dehydrating agent is used, the amount in each stage should not be less than 10 times the volume of the tissue in order to ensure complete penetration by the dehydrating solution. Characteristics of an ideal dehydrating solution. First, it should dehydrate rapidly without producing considerable shrinkage or distortion of tissues. Second, it should not evaporate fast. Third, it should be able to dehydrate even fatty tissues. Fourth, it should not harden tissues exclusively. Fifth, it should not remove stains. Sixth, it should not be toxic to the body. And seven, it should not be a fire hazard. So the commonly used dehydrating agents, we have the alcohol, most common, acetone, dioxane 4-siloxane, triethyl phosphate, and then tetrahydrofuran. We move on to alcohol. So this is the example. Ethyl alcohol or ethanol is the alcohol recommended for routine dehydration of tissues. It is a clear, colorless, flammable fluid. It is considered to be the best dehydrating agent because it is fast-acting. It mixes with water and many organic solvents, and it penetrates tissue easily. It is not poisonous and not very expensive. While methyl alcohol is a toxic dehydrating agent primarily employed for blood and tissue films and smear preparations. Butyl alcohol, which is utilized in plant and animal micro techniques, is a slow dehydrating agent, producing less shrinkage and hardening than ethyl alcohol, and is recommended for tissues which do not require rapid processing. So the tissue is passed through a series of progressively increasing concentrations of alcohol. So concentrated alcohols, 95% or absolute, will tend to harden only the surface of the tissue, while the deeper parts are not completely penetrated. This will result in a relatively unequal impregnation of tissue, with consequently poor cutting of sections. To avoid this, 70% or lower concentrations of alcohol, and then you gradually increase it up to 95%. So the strength of initial alcohol required in each concentration will depend upon the size and nature of each tissue and the fixative that is used. Generally, the smaller and more delicate tissues will require lower concentrations, starting from 30% concentration, and shorter intervals between changes of succeeding ascending grades of alcohol. It should always be ascending. We have here a general schedule in hours for alcohol dehydration. So different fixative, different schedule of alcohol dehydration. So for example, we have the Zenker and Helles, and then also the Fleming's fluid. It starts with running water and then alcohol of a 30% concentration. then 50, 70, and then 90. And then, meanwhile, sa 10% formal saline and buoyant fluid, they start at alcohol of 70% solution. And then for the formal sublimate, it starts at alcohol of 90% solution. So a temperature of 37 degree will hasten dehydration time and is especially used for tissue sections that require urgent examinations, such as fragmentary biopsies. To ensure complete dehydration, a layer of anhydrous copper sulfate, about 1/4 inch deep, is placed in the bottom of the container and covered with filter paper. This will accelerate dehydration by removing water from the dehydrating fluid. A blue coloration of copper sulfate crystals will indicate full saturation of dehydrating fluids with the water. Alcohol is then discarded. Now we move on to the second dehydrating agent, which is acetone. So this is an example of an acetone. Acetone is a cheap, rapid-acting dehydrating agent utilized for most urgent biopsies, which it dehydrates in 1/2 to 2 hours. Acetone is a clear, colorless fluid that mixes with water, ethanol, and most organic solvents. It is rapid in action but penetrates tissue poorly and causes brittleness in tissues that are placed in acetone for a long period of time. Most lipids are removed from tissues with this dehydrating agent. Its use has been limited only to small pieces of tissues due to its extreme volatility and inflammability. Because of considerable tissue shrinkage produced, acetone is not recommended for routine dehydration process. The third dehydrating agent is dioxane or diethylene dioxide. This is an example. So dioxane is an excellent dehydrating agent and clearing agent, readily miscible in water, melted paraffin, alcohol, and xylol. It produces less tissue shrinkage as compared to alcohol dehydration. Tissues can be left in this reagent for long periods of time, unlike acetone, without affecting the consistency or staining properties of the specimen. Because dioxane is miscible with both water and paraffin, tissues may be placed directly into the solution after washing out. However, tissue sections dehydrated with dioxane tends to ribbon poorly. Aside from being expensive, dioxane is also extremely dangerous, and this is its main disadvantage. Its vapors produces a cumulative and highly toxic action in man. That is why it should not be used routinely. The laboratory room should be properly ventilated, and all residues should be washed down into the sink. It should not be recycled as the risk of recreating explosive peroxides increases greatly. So the following is an example of a time schedule for dehydration with dioxane. We have the Grobner's method. So first, you do 1 hour of the first pure dioxane solution, then the second pure dioxane solution for another hour, the third pure dioxane solution for 2 hours, and then the first paraffin wax for 15 minutes, second paraffin wax 45 minutes, and then the third paraffin wax for 2 hours. After you embed it in the mold and cool in water. So we have another method, which is the Weisberger's method. In this, the tissue is wrapped in a gauze bag and suspended in a bottle containing dioxane and a little anhydrous calcium oxide. Water is displaced from the tissue by dioxane and in turn absorbed by calcium oxide or the quicklime. Dehydration period ranges from 3 to 24 hours. Tissues which have been treated with a chromate fixative like the Rigaud's or the Muller's fluid should be thoroughly washed in running water for it to remove the chromate completely prior to the treatment with dioxane. Next, we have the cellulose or the ethylene glycol monoethyl ether. Please memorize that. So solusol dehydrates rapidly. The tissue may be then transferred from water to normal saline directly to solusol again, and stored in it for months without producing hardening or distortion. So caution, ethylene glycol ethers are combustible at 110 to 120 Fahrenheit and are toxic by inhalation, skin contact, and ingestion. Following exposure, the reproductive, fetal, urinary, and blood systems are particularly vulnerable to its toxic side effects. If it cannot be avoided, propylene-based glycol ethers should be used instead of the ethylene-based glycol ethers. Next, we have the triethyl phosphate. This is an example. So triethyl phosphate, in this, tissues are fixed, washed, and transferred directly into triethyl phosphate solution for dehydration. It removes water very readily and produces very little distortion and hardening of tissue. It is soluble in alcohol, water, ether, benzene, chloroform, acetone, and xylene. It is used to dehydrate sections in smears following certain stains and produces minimum shrinkage. Next, we have the THF or the tetrahydrofuran. So tetrahydrofuran is a reagent that both dehydrates and clears tissues since it's miscible in both water and paraffin. This is the same with dioxane. It can dissolve many substances, including fats, and is in itself miscible with lower alcohols, ether, chloroform, acetone, benzene, and xylene. It may be used for demixing, clearing, and dehydrating paraffin fractions before and after staining. It causes less shrinkage and is easier cutting of sections with fewer artifacts. It does not dissolve out aniline dyes. In fact, most staining procedures give improved results with tetrahydrofuran. Although the disadvantage is that THF is toxic if ingested or inhaled, vapors cause nausea, dizziness, headache, and anesthesia. It is an eye and skin irritant, and prolonged exposure of up to 6 months may cause conjunctival irritation. Because of this and its rather offensive odor, processing THF should be done in a well-ventilated room. Although Teflon gloves may be suitable, the use of THF should be avoided if possible, as there is no practical way to absolutely protect skin against contact. So we have the additives to dehydrating agents. So when phenyl 4% is added to each of the 95% ethanol baths as part of dehydration process, it acts as a softener for hard tissue such as a tendon, nail, or dense fibrous tissue. In addition, hard tissues can be immersed in a glycerol alcohol mixture or in Moliflex.